I am super, super excited to be introducing our next speaker. If you guys were here at the beginning, you probably have seen him, Dr. Jayaraj Salimath. He's a weight loss surgeon, and he spoke before about getting a perspective on weight loss and what causes weight gain and what causes it. Right now, he's going to be talking to us about, the topic today is really about gain life by losing weight. Gain life by losing weight. Understanding the key weight loss, diet, science, exercise, medical, and surgery option. I can't get the word out. Surgery options. So understanding the key to losing weight, diet, exercise, medical, and surgery option. Please help me. I am going to mute him now. Please help me in welcoming our next guest, Dr. J. Dr. J, please take it from here.
All right. Thank you, Christy. Thank you so much once again. Those who have heard me this morning, and we focused on how we gain weight and how gaining weight that doesn't belong in our body eventually ruins our life. Means it affects your physical health, that is your ability to walk, to do things around the house, as simple as sometimes my patients tell me they can't even bend down and touch their toes or even wipe their butt sometimes. So those are all physical issues. And then it affects physiological issues, which we talked about. Those are your health issues that are having sleep apnea, high blood pressure, diabetes, to women experiencing infertility, irregular menstrual cycles, breast cancer, you name it. Even urinary incontinence, gastric acid reflux, all of those things. And psychologically, if it affects your self-esteem and depression and all of those things. So you're carrying this excess body weight on you affects all realms of your life. So the focus, like I mentioned to you, life is what exists between food to food. From food you come, food you become. In between that is your life. So how losing weight is going to make you gain that life that you had lost back again, and to reliving and enjoying that life again. You have to make that as a focus. If you don't make that as a focus, if you're doing it for any other reasons other than health and other than, just for any of those things, anything else other than that, you're going to lose your focus and you're going to regain the weight back. That's what happens to a lot of people. Lack of understanding as to how to lose that weight, what they have gained. And in my first segment, if you haven't understood what makes you gain weight, please go back and see that. Now, coming back to, first you got to understand the benefits of the losing the weight. And then that makes you motivated. We all are at we all need some motivation. That's what we are all here, to motivate each other and to help others to understand whatever that they needed motivated to. Here I am to motivate you to help you lose weight. So if you make life as an important goal and to get healthy as an important goal, to motivate yourself to lose that excess weight. First of all, losing weight helps you physically. Simple. As simple as getting up around, moving around. It will be less painful. Some of my patients tell me, I cannot believe that I'm able to bend down and tie my shoelace, or get up and walk without hurting. And people that were told that they needed to have their back surgery done because they're having so much back pain. Now they don't even have to have their back pain. They no need to have their knee replacements done. So these are physical ailments that due to just carrying extra burden. Sometimes, like after 6-7 months of weight loss, they lose about 80 to 90 pounds. And I tell them, if you ever want to feel what it is like to have been carrying that around, if you ever feel like you want to start see the donut or ice cream or chocolate or anything that you want, you can't resist, you want to eat that and gain that weight back, I say, go to the superstore, pick up a 40-pound salt bag, put it on your back, and walk around 2 or 3 aisles or until you shop. See what it feels like. That's what we talk about. When you carry your weight on all over your body, you won't even realize that you're carrying that burden on your body, physical body, all day, all night. So it causes the joints to wear out, the cartilages to wear out, and the discs in between the vertebral column to wear out. So just by losing that extra weight unburdens your body joints, the shock absorbers, and you start to feel better right away. Physiologically, you lose the weight. First place you lose the weight is your liver. Like I mentioned to you earlier, when we start gaining weight and how fat gets deposited in the liver, and it starts to affect your metabolism, and eventually sometimes it leads to hepatitis and it leads to liver failure. That's why when you start losing weight, the first place you lose weight is your liver, because you want your metabolic factory to become healthy. Once you start losing, and that's what a lot of people call it as detox diet. They're detoxing their liver. So when you lose the weight, your liver functions improve. Fat in the liver, hepatitis that has been there, that starts to resolve. If you have cirrhosis of the liver set in, even that gets better. Next place you lose weight is where you put the last part of the body. Last part of the body anybody puts weight is on the face and the neck and the inside of your mouth and all those things. As you start losing weight there for a second, you start to breathe better. Your effort to breathe better and your snoring is one of the first things to kind of go away as a notice as you start losing weight. As your air passageways start to clear up, you start to sleep better and breathe better in your sleep, and thus your sleep apnea goes away. When your sleep apnea goes away, I said there's a direct link to sleep apnea and high blood pressure. Your high blood pressure starts to improve. And when your high blood pressure starts to improve, guess what? Your heart doesn't have to work as hard. So your cardiac functions, heart functions better. Earlier I mentioned, as you gain weight, extra fat produces what we call exogenous estrogen. Your estrogen levels will start to go down and start to bring back your testosterone level, which was suppressed. Because both men and women, we need both hormones, both estrogen and testosterone. This testosterone is the level starts to come back up. In women, their menstrual cycle starts to get very well regulated. Their menstrual cycle starts to become more normal, shorter duration, and predictable. Heavy menstrual cycles will go away. In younger women, their polycystic ovary disease starts to get better, and those who have been suffering from infertility, they will be able to get pregnant. Acid reflux is one of the millions and millions of people suffer from acid reflux. As you gain weight, your pressure on the stomach goes high, and that also leads to sometimes as you gain weight, you develop hiatal hernias, which causes you to have severe reflux. Losing as much as 25 to 30 pound weight will significantly improve your acid reflux issues. Number of migraine headaches you get goes down. High cholesterol improves. Women that are over 40 and have had children in the past and they're suffering from urinary incontinence because they've gained weight, guess what? Your urinary incontinence improves significantly. There are studies that have shown, even if you're suffering from some of the Interstitial cystitis, that is irritable bladder, even that improves. Joint pain improves. All of these things starts to, this is what I'm talking about. When your health starts to improve, you automatically feel vibrant. And thus, you're going to start feeling less depressed about your life, and you start to enjoy it. So that's what we talk about, getting the life back. I have people that were on 11 different medicines at end of 6 months of losing the weight. Today, they're off all of their 11 to 20 different medications. Diabetes is one of the first ones to respond very well to weight loss, especially type 2 diabetes. If you're suffering from type 2 diabetes and taking several different medications, metformin, Victoza, and insulin, all of those can be taken off, especially if you're a type 2 diabetic. Even if you're a type 1 diabetic, if you lose weight, it helps significantly to control the blood pressure. The blood sugars. They will be much easier. Now, these are all the benefits. The $1 million question is like, how do you get started to losing the weight? First is, earlier we were talking about the fad diets. What happens when you take in imbalance of these macronutrients, fat, carbohydrates, and proteins? It is better to eat a very well-balanced diet in a less calorie versus imbalanced diets, like ketogenic diets and protein-rich diets are all what we call them as imbalanced. They are like telling you to stop eating carbs altogether, which will eventually lead you to gain the weight back. You may lose weight in the beginning, but in the long run, it's not sustainable weight loss. In order to have a sustainable weight loss, you need to incorporate healthy carbohydrates to at least 30 to 40% of your calories per day to be from carbohydrates, because body does not store carbohydrates. It uses it as an energy source. Proteins, there's a lot of myth about how much protein you need per day. And everybody has a myth that animals are the only source of protein. But my question to you is, what do those animals that you're eating eat? Plants. Plants are the only things that can provide you protein that all of us need. So adding more vegetable to the diet will not only provide you healthy carbohydrates you need, healthy protein you need, it'll provide that. And then fat is not like in the beginning of the talk earlier I mentioned in the earlier talk. Fat is not all bad. Without fat, you won't survive. So you do need to incorporate at least 10 to 20% of your calories from coming from the fat. The goal is to try to lower your caloric intake down from carrying excess weight. If you're eating 1,800 to 2,000 calories, bring it down to 1,000 to 1,200. Or if you're carrying 100 to 200 pounds weight, you can easily survive by daily intake of 750 to 1,000 calories while you're losing weight. Because I said, you have been hoarding that energy, all parts of your body can convert, right? So let all the storage, that hoarding, get rid of it, start to get rid of it, start using it. All the fat can get converted to energy by supplementing what you're not taking. So this is the diet part. When we talk about diet, I tell people first round is eliminate all the easy calories. Those are your sodas, juices, crackers, cookies, donuts, you name it. Eliminate that as a first round. Make them as a treat. You don't have to give it up. Make them as a treat, like once a month, or once a month when you go out, have a glass of soda. Nobody says. When you go to ice cream parlor, Get an actual scoop. How many of you know what an actual scoop of ice cream is? It's not the American scoop. If you want to experiment it, take American scoop ice cream, take a watermelon or your favorite fruit, just carve it and see how small that ice cream scoop is. Scoop is supposed to be this small. An American scoop is what I call it's be this big. That's the difference. That's what we call controlled portions. Control your portion of your ice cream. If you go to a pop movie, don't pour all that butter, on the popcorn. Popcorn is supposed to be the most healthiest, low-calorie food that is out there. But what do? We make it the fattiest. On top of it, put salt and all kinds of extra calories we add to it. The same thing we do with juices. If I told people to go eat 4 to 6 oranges at a time, they'll say, are you crazy? Where am I going to have time for bacon? Where am I going to have room for eggs and biscuits? Mm-hmm. But the same person will not hesitate to drink 8 to 12 ounces of orange juice first thing in the morning. But if you take a whole sack of oranges and try to squeeze 4 to 6 ounce or 8 ounces of oranges, that's how much it takes. Mm-hmm. That is the reason I tell people to give up drinking the juice. If you want to drink orange juice, eat an orange. If you want to drink grape juice, eat grapes. Probably you'll eat a handful of grapes, by then your mouth will become sour. Imagine if you had to squeeze 8 ounces of orange juice out of the grapes, how many grapes it would take. Mm-hmm. So you got to change your thinking process when it comes to portion control. You have to become creative and innovative way of thinking of the food. Same thing goes to food. I always mention, try to go back to what our grandparents and great-parents used to eat. Know what is in your food. Processed food industry hates me for telling this all the time. Because a lot of times they are adding substances that you don't even know it is food. People have conducted various sorts of experimenting, leaving the McDonald's fries and bun and patty outside. Not even bacteria wants to eat it. They sit there, and it has to be biodegradable easily. If your food sits there outside and that doesn't biodegrade, it's not food. Think of it like that. The same thing happens to you. Your body should be able to easily digest and be able to eliminate it easily. And then cut down on the fast food. How much fast food you eat. That's what we're talking about, processed food. Make them as a once a week instead of eating every meal. Try to take food to work instead of eating out. Fast food industry has the various ways of making you eat extra calories, from music to the playing at different varieties of music to what they add in it. On an average, you consume 400 to 600 calories extra per meal if you ate that meal outside versus you packed at lunch. Simple change, makes a huge difference on how much calorie you take in. Start getting into the habit of cooking your own meal. Know what goes in. Anytime possible, add more vegetables to it. And drink water. Water is I cannot believe now people have to tell them it has no calorie. People know that, but people still go by diet water. How can water be diet water? It amazes me. People get conned all the time, just buy simple water, and that has absolutely no calories, and it costs you nothing. It's the Mother Nature gives you for free. That's the diet part. The important second part of losing weight is the exercise. Without exercise, you're not going to absolutely not lose any weight at all. You have to, in a 24-hour period, you have to dedicate at least an hour a day to do physical movement. I tell people, if you cannot walk, all you can do is sit. There's 100 different ways of exercising, sitting down exercises. All you can do is lay on the back and not move, able to move. You can still sit there and wiggle there. You have to move your body to able to burn the extra calories that you're carrying. Find it doesn't matter what exercise, something that you love. It could be bicycling, swimming, walking. As we get older, our body's metabolism slows down. The best way to boost your metabolism is by exercising. Earlier I mentioned, as you lose weight, your sleep improves. Sleep and rest is as much important losing weight as exercise itself. Try to get at least 6 to 8 hours of sleep every single day. Don't stay up all night binge watching all these shows, and people are hooked to their phones and internet. They waste on an average 4 to 6 hours a day watching these internet things. And instead of that, turn off your cell phones, turn off your gadgets, give it a break, and go out and enjoy the Mother Nature. All the young people that are listening to me, stop living in the virtual world. Start living in a real world. It's warm, beautiful outside there. It'll make you vibrant and healthy. You see the Mother Nature. You don't have to pretend to experience. You can actually feel it and breathe it, smell it, and hear it without any gadgets. All you have to do is just get yourself out of the house and a beautiful sunshine and walk. And take a walk in the Mother Nature's. That, along with that, have a good social network of friends. Stress, that's the best stress reliever. Going out with friends, having a laugh, having a chat, unburden your daily stresses. Because stress in your life causes your body to release excess cortisols, which will make you gain weight. So unburden your stresses in your life. Physical exercise and socializing helps two things. It reduces your stress level. It releases natural endorphins that makes you pain-free, and it elevates your mood while losing weight. That's what we want. So when you have no time for all of these things, but you're so overweight and you're unburdened by a lot of health issues because you've gained a lot of weight, that is when you need to seek expert advice. That's where the medications come in handy. There's a lot of medicines out there. But the problem with medicines is they have side effects. A lot of the medications have side effects. They're all what we call sympathomimics, and also some are appetite suppressants. But the problem with them is they all have what is called as tachyphylaxis. Like, example of tachyphylaxis I can tell you is, you wear a shirt every day. You don't know, after some time, you don't feel the shirt. But all of a sudden start changing the shirt from cotton shirt to silk shirt. Your body is seeing for the first time that silk shirt feels totally different. The same way, after some time, these medications stop working the same similar fashion. Tachyphylaxis is like after a certain time, the medication quits working for you to help. But it has the side effects of high blood pressure, kidney failure, to heart attacks, and destroying your heart muscles and those kind of things. So I wouldn't suggest using medications for a long time durations. And there's a lot of over-the-counter medications. They are all nothing but excess amount of water pill, which we use for diuretics that are there. an excess amount of caffeine that is there, an unpurified version of sympathomimetics like speed, what we call, the street name. Those kind of drugs are in there. So those, in an uncontrolled fashion, can be dangerous to you. And a lot of people talk about using the colon cleanse and liver cleanse and all of those things. Those are all just gimmicks to tell the people to buy their product, and you will not lose any weight. Don't waste your money buying those kind of things. Lipozene and hydroxycut and all of these things, they are all just fraud. Please do not use and ruin your health. Just make changes that I mentioned to you earlier. Now, when it comes to the quickest way of helping you control the calorie intake is the surgical weight loss. There's a lot of varieties of surgical weight loss out there. In surgical weight loss, we categorize them into three main categories. One, restrictive surgeries. Second one is malabsorptive surgeries. And then there's a mixed categories of surgeries. In the restrictive surgery means our stomach is the one organ that determines how much you can eat in one single sitting and control and feel full. On an average, adult stomach can hold up to 33 to 44 ounces of food before it feels completely full. By changing the size of the stomach, we can kind of force you to eat smaller amount of meal. In that, we have sleeve gastrectomy, which is very popular surgery currently, where we take out 90% of the stretchy part of the stomach. And another surgery that used to be popular in the 90s and early 2000s was the lap band, which is a silicone-based band that we put around the top portion of the stomach, which has a balloon inside. By adjusting the balloon size, we can force you to eat smaller meals and feel full. And there is gastric bypass, where we cut the stomach into two parts and make the stomach to 1.5 ounce pouch. And we reroute the small intestine based on your weight. Anywhere from 3.3 feet to 6 feet of small bowel will be rerouted to help you decrease the absorption of the food that you take in. And there is another one called Duodenal Switch, which is also, they give you a little bit bigger stomach pouch compared to the gastric bypass. And they bypass almost 15 to 16 feet of small bowel. That means you have a lot more malabsorption, means you don't absorb the food that you eat compared to the gastric bypass. In gastric bypass, you eat smaller meals, but you can absorb a little bit more than the duodenal switch. But surgeries do have side effects. But the surgeries will help you lose that excess weight within the first year to year and a half. The risks that you have to always consider with surgeries are the malnutrition that comes if you don't take the proper vitamins, and there's always a risk of anastomotic leak, means the gastric pouch leaking or the small bowel leaking, you developing ulcers. When you lose weight rapidly, you could develop gallstones. And sometimes if you do not follow the diet, if you don't stop taking the acid reducing if you don't stop taking the anti-inflammatory medications like Motrin, you can develop ulcers. And especially if you're a smoker, you can develop ulcers at the hookups. There is a lot of changes you have to make, even with surgery. Surgery is not an easy way out. A lot of patients say, "Oh, my friends accuse me of taking the easy way out." But if you talk to any of my friends, they will tell you it's not an easy way out. So, in a nutshell, losing the weight, there's many methods, but you can take all of these steps combined, you can be very successful at losing weight and maintaining it. Because of the short duration, I cannot elaborate any of these surgeries. So, in another meeting, we'll talk just surgeries alone, and then I can show you exactly the images of the surgeries and the drawings of the surgeries, how it works in detail. Christy, am I on the dot for the time?
Yes, you are. You are absolutely on the dot on the time. And I just want to, a second, just tell the audience how to contact you.
You can always send me personal questions to my personal email, Salimath, that is JSALIMATH @yahoo.com, or you can join my Facebook group. It is Gain Life by Losing Weight by Dr. Salimath. And once again, the Facebook group is Gain Life by Losing Weight by Dr. Salimath. Thank you very much for listening to me. Thank you, Christy, for giving me this opportunity to share my knowledge. And I would like to explore more and give your audience more ideas in the next segment, whenever that is going to be.
All right. Thank you so much for imparting the knowledge. You shared a lot of nuggets, and I'll be bringing you to my TV show. We're going to talk, and I'll find out what time you'll be coming in. So thank you so much, and I appreciate you. Bye-bye now.